Good morning, everyone. Welcome to, I think, the last session before lunch, so whatever that all means. Thank you for the great slideshow that was behind us. A great thank you to National Minority Equality Forum and especially the Center for Sustainable Health. Some incredible stories, incredible statistics. You saw them all on screen. You're going to see them come to life with our wonderful panel. Welcome to our panel discussion on driving vaccine equity and promoting health in communities of color. Today, we have gathered experts in the field of medicine and public health and in community engagement and faith-based leadership to share their insights and perspectives on the topic of vaccines. Vaccines have been an essential tool in the prevention of infectious disease, and globally speaking. However, vaccines can be a complicated topic with uncertainty around safety and efficacy and access and equity. With the ongoing COVID-19 pandemic, vaccines have been at the forefront of global attention, and it's highlighting the importance of understanding the science behind the vaccines, addressing misinformation, and ensuring that we have equitable distribution of the vaccine. This really underscores the point that vaccines are great, but only vaccinations make a difference. Through this panel, we aim to explore the benefits and challenges of vaccines and strategies to improve acceptance and access. We hope that this discussion will contribute to a better understanding of vaccines and their role in protecting public health. Joining me for this discussion, we have Danielle Casanova. She's the Vice President of Population Health Initiatives and Health Equity. Dr. Keith Ferdinand, Professor of Medicine at Tulane University School of Medicine. Amy Harris, the Associate Executive Director of Ambulatory Care Services at New York City Health and Hospitals, Elmhurst Division. And Pastor Nicole Slater, pastor at Payne Chapel AME Church in Birmingham, Alabama. The esteemed panel here will describe their background more in a minute and also give greater detail of the creative and impactful work that they have been doing in their communities to bring healthcare. First, I get to give you a perspective of a pharmacist. I've heard we've had some pharmacists in the room. My good friend Tamara, she's out there. I heard her on the mic. There she is. I'm going to check on the slides. How many other pharmacists in the room? All right. How many nurses in the room? All right. Physicians, nutritionists, dietitians, chiropractors, dentists. Give it up for all the healthcare providers, everything they've been doing over the last several years. So thank you. So I've been with Walgreens for 25 years now. It's been several roles, but 25 years ago, I started off as a pharmacist on the front lines. When I first started, pharmacists didn't even give vaccines. When I got to the end of my practice, roughly 10 years later, it had become the service that pharmacists were most recognized for beyond dispensing medications. So quite a journey. I'm remembering my first off-site clinic that I conducted. It was in 2008. It was outside of my pharmacy in our parking lot in Virginia. I gave 12 people their flu shot that day, 12. So fast forward, and I'm remembering a discussion I had with these fine gentlemen in the front row here yesterday. I'm reminded by a clinic that we conducted in the Atlanta area last year in partnership with many folks that are in the audience today. Our pharmacists protected over 7,000 individuals during that clinic. So from 12 to 7,000. Say it's a pretty good trajectory. Here's an exercise. By a show of hands, who here in the audience has received let me just say this, a healthcare service, so call it a health screening, a COVID test, or a vaccine from a pharmacist or a local pharmacy? Get out of the light. Oh, wow. That's a lot. Another show of hands. Who here thinks that it is a good idea to utilize pharmacists, that it is an effective strategy to utilize pharmacists to increase reach to people and impact outcomes around vaccine preventable illnesses? All right. Well, I'm going to blow your mind. Because of the interventions of pharmacists and the connections to people. And when I say that, I mean the over 40,000 sites that are across the country that are serving as vaccinating sites, over half of them located in areas of high social vulnerability. The over 70,000 long-term care facilities that were visited by pharmacists to help provide immunizations to the most vulnerable. And to the over 11,000 offsite clinics that were conducted to get closer to communities where they are. All those actions together, conducted by pharmacy and pharmacy personnel, resulted in us as a country averting over 1 million deaths, 8 million hospitalizations, and $450 billion in healthcare costs. So there you go. Thank you. I hope to blow your mind. Did I achieve it? So through it all at Walgreens, our North Star has been to ensure that there's equitable distribution and access to the vaccines. And I've seen it firsthand when I was practicing on the bench, and I served in underserved areas within Florida, within Ohio, in the DC region here. It's not enough to just be there. You can't just rely on if you build it, they will come. Vaccines, as I mentioned, is a very complicated topic. So a more informed strategy was needed to reach people. And at Walgreens, we built that strategy upon 3 pillars. First, to provide education and information, to listen to our patients, what questions that they have, what are the reasons why they want or don't want a vaccine, and address that versus taking for granted that everyone is ready to be vaccinated. Establishing partnerships to get closer to communities. Again, listening and learning from those that live in the community and that understand best sort of the local and social and economic dynamics that are involved in the community. You know, nothing trumps trust. You know, I, as a pharmacist, or all the medical providers we had in the room, we can spit out science all day and make a great case. But it's going to be that voice that says everything is going to be okay by taking this vaccine that's going to eventually convince that patient to get it. Lastly, creating access points that work for the individual. Now, that may mean finding your way to a pharmacy or a clinic, or it may mean us meeting them at their church, or meeting them at their home, or providing a ride through Uber for them to get from their home to a vaccinating site. And those were the efforts that we were able to showcase through 2 programs that I'll quickly highlight. First, our free flu shot program that I cherish the partnership with many in the audience that Walgreens has been able to conduct over the last decade now. We go to communities where folks are uninsured or underinsured, and through our program, we've been able to administer more than 2 million vaccines to individuals there. Next, our COVID-19 vaccine equity efforts. Again, the local and national partnerships that allowed us to reach so many different communities across the country to the tune of conducting over 2,000 clinics. What is really encouraging about all of this, and I'll close with this, at any of these events, in each of these events, we meet people that are getting a vaccine for the first time in their life. Heck, sometimes it's the first time that they've ever interacted with a healthcare provider. But what I'm so hopeful for is that many times we see those patients return to the pharmacy to get their second dose, or we hear that they made it to Amy's clinic because we referred them to her to get a physical, or they ended up at Pastor Slater's church to attend that diabetes screening events. We are getting people activated about their health care, and that is a good way forward. So enough from me. I want you to hear it from folks on the front lines that have the closest connection to people that need health care. We're going to listen and learn from these folks, and collectively we'll come up with great ideas and strategies to really move the health equity movement forward. Thank you.
You hear me okay? Great. For the to
Just speak up a little bit. So
all right.
yeah.
Now do this maybe. Okay. Should I go?
It's up to you.
No, I'll sit here. Slides up. Thank you. Okay. I was just with my. That's better. Is it better? Yes. Okay. Thank you again, everyone, for this opportunity, and to NMQF for allowing me to be here to talk a little bit about the work that AMJ is doing. Coming to you from a different perspective, not necessarily from direct patient care, but working with providers and health systems across the country. AMGA, also known as American Medical Group Association, is a trade association that represents health systems, integrated delivery systems, and academic systems across the country. And our mission is really to advance the multi-specialty medical group and integrated delivery systems as that preeminent model of care, and with the core mission of advancing high-performance healthcare as well. We have, and just to give you a little context of the type of trade association we are, our membership is, again, those health systems and integrated delivery systems. There are group memberships, so not individual members, but their employees within our organizations are our members as well. And we have about 400 plus AMJ member groups who are part of our membership. This number goes up and down as there have been a lot of acquisitions and consolidation across the country of health systems. But there are about 177,000 physicians that practice at our AMJ member groups, seeing over 142 million patients annually, and that's 1 in 3 in Americans who receive care from any of our affiliated groups as well. So just to give you some context there. As an organization, we made a commitment a couple of years ago to address health disparities. And last year, we added that to our strategic plan. And we wanted to make sure that that was a focus for our member groups. And this is a snapshot of just some of the organizations that you might be aware of, that you might actually receive care from across the country. Our membership is very diverse, from large multi-specialty groups, integrated delivery systems, affiliated with hospitals, not affiliated, independent physician-owned groups, and smaller medical groups as well. And one of the things that we wanted to be able to do in supporting our members in terms of health equity is to provide resources and tools for them in order for them to address health equity and the social drivers of health for their patients and their communities they serve in as well. And so this is something that we've been doing for a little while through our programs and initiatives and some education, but didn't really make it intentional or mandatory for our members when participating in our initiatives. And as of last year, this became a priority for AMGA and for our members, all the way from our board of directors and our president and CEO, Dr. Jerry Pinto, made this a priority for AMGA and for the health systems that we serve as well. So because of that, I've been tasked to create and lead AMJ's health equity strategy to help our members address health equity and the social drivers of health within their patients, for their patients and their communities. So we're really in the beginning infancy stages here at AMGA in terms of developing and planning and development. And one of the first things that we were able to do is cultivate a steering committee of experts and leaders among AMGA who've been in this space for quite some time, has a passion for it, and have really worked on the front lines and with their leaders in their own systems to deliver equitable care for their patient population. And we're in the process of developing partnerships and cultivating with organizations like yours who are doing the work on a daily basis, that we can provide connections to our systems who really want to figure out how to do this. Our organizations are on their various places in the journey of health equity. Some, again, have been working towards this for upwards of a decade or more, but there are many within that 400 plus membership base that we have that are really at the beginning stages of this and asking the questions: how, what can we do, what resources, and what is the information? And I really think that based on the conversation and the discussions I've heard yesterday in the panels, a lot of those answers are in this room right now as well. In addition to that, we want to learn from our members and understand their needs and building momentum among our membership, learning from them and identifying what do they need in order to drive health equity in their institutions. And more importantly, not necessarily within their four walls of their health systems, but in their community population as well. Mobilizing our internal assets. We also have a foundation, a nonprofit arm of the trade association that focus on chronic disease population health initiatives, which I also serve as a member of as well. And we are developing and launching initiatives with these health systems to not only improve care for these chronic conditions and preventable illnesses, but we integrate addressing disparities and social drivers in all the work that we do. So how can we better promote that and share those best practices and insights as well? And lastly is the data solutions, creating data, innovative data solutions for our members as well. And what does that look like? There are some members who have developed health equity dashboards who are beginning to stratify their data by race, ethnicity, gender, age, etc. And then there are a lot who are not. So we want to learn and to figure out what are those insights and innovative solutions that we can develop or share that's already developed out there with our members and promote that as well. So I'm really here to talk a little bit about flu and influenza vaccination. And one of the things that we are proud of is our Rise to Immunize National Health campaign. Just a little background about that. A few years ago, our foundation launched an adult immunization collaborative, best practices learning collaborative on influenza and pneumococcal vaccination, which my team led. And we had about 42 health systems participate over 3 years, and they were able to administer and document over 5.5 million vaccinations for flu and pneumococcal. And because of the success of that program, that initiative, that led to the development of our third national health campaign, Rise to Immunize. And that's with the goal to, a 4-year campaign with a goal to administer and document 25 million vaccinations by 2025. And that includes flu, pneumococcal, Tdap, and zoster as well. And in our first year, the campaign launched in 2021. So the first year impact for flu, at least, we were able to administer 3.7 million influenza vaccines for the ages 19 and older. So we're looking forward more engagement and more reach as well. And we have about 77 AMJ members who are enrolled in the campaign, and we're continuing to enroll more groups throughout the year. And that reaches over 29 states as well. And lastly, I just wanted to share some really brief high-level interventions that some of the groups are implementing and have been implementing successfully in their systems and their communities. And a lot of what you've talked about over the last day and a half, actually, about understanding the population needs. Members are administering annual needs assessments to identify what their needs are. They're stratifying their population to target their populations and prioritizing the work that they're doing and measuring demographics as well to be able to better understand that. Building trust. I feel like the word trust has been on repeat over the last day, and it will continue to be that because that's certainly important. Targeting our messaging and outreach, and then increasing access. We've all seen that this was pretty successful during COVID. Health systems were able to come up with innovative ways to administer vaccines during COVID with the mobile health clinics, drive-through clinics, and so forth. And they're continuing to do that for flu and pneumococcal and other vaccinations as well. And last but not least, creating partnerships with other community organizations, with NMQF through the DRIVE program, as well as other partnerships with corporate partners to engage with the community as well. So thank you for this opportunity, and happy to answer other questions later on.
Thank you very much for this opportunity. First of all, my title is Professor of Medicine, Gerald S. Berenson Endowed Chair in Preventive Cardiology at Tulane University in New Orleans, Louisiana. That's an historically white institution located in a city that was founded in 1698, one of the oldest cities in North America, wasn't part of the United States to 1803, founded by the French, built by enslaved Africans, and then free people of color from the Caribbean, and then European immigrants. And the reason I give you that history is because that professional title is not really how people in New Orleans know me. Mm. If you were in New Orleans, they would say, O'Keefe from the Ninth Ward. Yeah. The whole point of me as a cardiologist being involved in flu vaccine drives is because our Healthy Heart Community Prevention Project since 1993, that's 3 decades, have been trying to bend the curve of death and disability in the Black community. If you look at statistics, there's always been a white-Black mortality gap, where persons who would be identified as Black or African Americans have shortened lives. I'm not talking about bad tweets or bad social posts calling somebody out of their name. I'm talking about life, death. So we embraced flu vaccine built on the platform that we've been doing for decades. It's led by my wife, Dr. Daphne Ferdinand. She's not here. You'll see her picture when I show a few snapshots. And the flu vaccine effort was supported by Laura Lee Hall and Chinny. I think they're here. They said hello to me. And we use that as an opportunity to try to help our people live better lives. It's not that I'm in love with flu vaccine. It is a tool to help people help themselves. And if you look at what we have been doing for many years, it's built on the knowledge that these viruses are part of the environment just like we are. In fact, I first started out in history. I got into medicine because it was something that I knew would help people. And if you look at history, we thought that the Europeans came and shot up the place and took over countries and regions. It didn't work like that. What happened was a few people came with muskets. They weren't AK-47s, but they brought viruses and infectious diseases to which the people had no immunity. So across the globe, over years, you've seen these major pandemics that decimated populations. And unfortunately, here in the United States, on a recurrent basis, more people die and are hospitalized who are identified as Black, the first bar, the tallest bar, from influenza. We could show the same bar for COVID. In fact, the white-Black mortality gap has gotten worse because built on the platform of shortened life expectancy from cardiovascular disease came COVID-19, disparate degrees of mortality so that time does not equal progress. And Max Roach said in 1968, the jazz master, members don't get weary. St. Paul said the same thing, ye brethren, don't get weary. It is kind of hard for me to come to these sessions, and I've been doing this as long as some of you have been alive, and talk about disparities and watch them continue, and now even widen. So if you look at what we've done in New Orleans, we've addressed flu vaccine because the same people who have death and disability from cardiovascular disease, those over 65, and I should mention everyone should get the flu vaccine because if you're younger, you may infect your older members of your family and community. Those with heart disease, diabetes, sickle cell disease, chronic kidney disease, they're the ones who have the highest death and mortality. So we know it's a respiratory virus, but it's not a cold. In fact, I kind of shudder when you look at television, they say cold and flu remedies. Well, the cold is a rhinovirus. Rhino means nose, rhinoceros. Influenza goes throughout the body and it inflames all the organs of the body, including the vasculature. People who have heart disease are 10 times more likely to have a heart attack or stroke after the flu and can even die. This is the updated CDC guidelines. I think most of you know that unless you have an allergy, and there are now flu vaccines which can be made without a protein being present, everybody should get the vaccine. And the question that comes up is, well, I got the vaccine, I still got the flu, or I got COVID vaccine, I still got COVID. We're simple human beings with simple tools. We're not God. All of our tools are imperfect. But if you are immunized, when you get the infection, you may get some illness, but you're not going to have the same level of hospitalization and death. That's the point. This is one of our flyers. We call it Flu NOLA. Those of you know people from New Orleans, they'll tell you, if they're in Seattle, they'll tell you, I'm from New Orleans. So we call it Flu NOLA, New Orleans, Louisiana. And we would go into the communities, various centers, and they're listed on this flyer. We started in October, November. We went one into January. You can take the flu vaccine all the way into the early spring, but we wanted to get the bulk of our work done during the highest parts of that particular pandemic. And if you look at Joe Brown Gymnasium is a regular ballpark gymnasium out in the community. Milne, another recreation center. Sanchez Multi-Center Center on Fats Domino Boulevard. Fats Domino is a rock and roll guy. Cherry Hill, I love don't worry about it. And the New Orleans East Hospital is a small community hospital. So we went to where the people were in order to do our effort. And I'll just show you some snaps. I'm happy that we heard from Walgreens. Unrelated to this program, Sandra Tate is the regional manager. She worked as an integral part of our particular program. You see their name on there. And they have been very helpful with some of the efforts. You see other logos for multiple members of the community, along with sustainable health. And the idea is not to go out there by yourself, but to have a legion of people around you. Because by having many, you could have a stronger effort. And you can see that the people who are coming diverse in terms of race, ethnicity, mainly African-American, because New Orleans, we can't use the word minority because most people are people of color in New Orleans. The mayor is, police chief is. I don't use that to mean that we're running anything because the uptown folks and the Fortune 500s who own the hospitals and hotels, they run it. I mean, but we're the people who are there. But you'll see a very diverse population, a lot of settings. In the middle at the top, you see Dr. Daphne. I often say, and I'm very open about this, and I'll say it and the people in the community know it, is that they'll ask Dr. Ferdinand to come and give a remark, et cetera, and I come and do a cameo, but she does all the work. I don't do the work. So you see Dr. Daphne in the middle, people getting their vaccinations. We think we made a difference. The main thing was to get the information, drive them into the pharmacy. I was professor of pharmacy at Xavier University also. Drive them to the pharmacy, drive them to their primary doctors and nurse practitioners. But if we don't do that, then we're going to repeat what happened to many people around the world. We will die from these infections, and it's just not necessary. We can do better. So I'm pleased to have this opportunity. I'm happy to be here, but do not get very enthusiastic about describing what we're doing and how we're doing it and this and that and the other, because we've been doing that for decades, and the white-black mortality gap is persistent. So we're going to have to continue. Members don't get weary, but at some point, we're going to have to talk more about our successes and what we can do to change the curve, that white-black mortality gap, which is very frustrating for me to see.
Thank you. My name is Amy Harris again. I work at New York City Health and Hospitals, Elmhurst. New York City Health and Hospitals is the largest public hospital system in the United States. Elmhurst Hospital is the most diverse hospital in the country. Elmhurst itself is the most diverse community in the country. We are very ethnically diverse. The languages spoken there, we always say we speak more languages than Google Translate. It's true. So it is a challenge to make sure that everything that we're doing is understood by everyone. And so even when I hire staff and they're bilingual, I tell them you're going to have to use a translator. Unless you speak over 200 languages, you're going to need a translator at some point. So when we talk about flu vaccination, it's not just about, patient education. It's about, and community resources. What we're going to talk about, I'm going to talk about community engagement as well as staff engagement. I think it's really important to talk about that. A little background, Elmhurst Hospital was unfortunately the epicenter of the epicenter during the COVID pandemic. In that particular area, 1 out of about 130 people died as a result of COVID. It was very hard, dark period for us. We lost coworkers, friends, family. The staff went through a very difficult time. We also had to operate, COVID testing. We stood up the first COVID testing unit in Queens. And when we had to do COVID vaccinations, we did a very good job of standing up COVID vaccinations. So when we had, that horrible time of COVID death and COVID disease, we kind of went from, and I don't mean to sound crass, we went from worst to first. If you look up on NewYorkCity.gov, you will see that we have a 99.9% vaccination rate for COVID. And Queens County, Queens County did over 2 million vaccines. And I personally feel like our clinics, our COVID did almost all of them. It felt like we did not, but it felt like that some days. We had a lot of challenges. And flu vaccine kind of got lost in the sauce, right? Everyone was like, COVID vaccine. And the staff were very COVID fatigued, right? They were vaccine fatigued. There were COVID vaccine mandates. You must get COVID, vaccine or else you will be terminated, right? So the outgoing chief operating officer who in prior years was in charge of flu vaccines. He handed it off to me and he said, good luck with that. Last year, we were at 32% flu vaccination rate. And I'm like, what? 32%? And I'm like, the overall, feeling for flu vaccine was pretty poor among the staff. And that kind of, came through with the patients too. They were feeling the same way the staff was. I mean, if the staff wasn't really feeling it, how was it going to translate to the patients? Not well. So I was like, well, we're going to have to be a little more enthusiastic. The cheerleader in me was coming out, but I didn't want to be a cheerleading team, a squad of one. So, I rallied some of the troops and I said, come on, we're going to make it fun. We're going to engage a lot of people. We're going to reach out to the same community-based organizations that we partnered with for COVID, the same politicians. We're really going to start, figuring out how we're going to do this. So we started doing some, fun things. We wanted to bring back some of the joy in healthcare. It doesn't always have to be depressing. It doesn't always have to be, frightening. We wanted to bring back some of the fun in healthcare. And we started in that last slide, I think you see in the bottom picture, right in the middle is our CEO. She's here in the front row. We are all wearing, that's the whole C-suite, and we're all wearing T-shirts. Those are our flu vaccine T-shirts. I have one here. And we bought them, and our logo's on the front. And on the back, we made a logo with our little character here. It says, keep calm and get your flu shot. And it says, live your healthiest life. And what we started doing is saying, we started putting out flyers and web blasts, and it said, limited edition, first 500 staff get a free T-shirt. Didn't buy that many. Limited edition, collectible. And And I kept telling people, ooh, if it's free, it's for me. And people came running. They were like, I want one of those. And I'm like, watch, we're not going to have to do any advertising. They're going to wear it and walk around the hospital wearing their t-shirt, and it's going to do the work for us. And sure enough, people start, you can see the picture right in the middle there. The staff were like, yeah, I got my flu shot. Then we also had Francisco Moya. He's our council member in New York City. He started having his own, he partnered with us, and he was doing, let's get people on board in the community, and I'll host a flu vaccine, health fair. And we brought our nurses out, and we started doing, oh, sorry about that. We started, oh, sorry, I don't know what I did there. It's not going though. I don't know what happened to my slides there. That's not my slide. Okay, we'll stay on this one then. What we started doing too is you can see the advertisement there for Flu Fairy, because you can do so much. You can have advertisement. When we ran out of t-shirts, we bought these. You're wearing some of you are wearing a lanyard now. A lot of people, I noticed a lot of our staff like getting pins. They like collectible pins. I think it started with Disney giving those. Some of you have been to Disney. They give out, like my kids wanted a pin. Like when we went to Disney, they wear it on the lanyard. So we bought the same logo. We made a pin, and you can see Kathy's wearing her pin. We gave out a few collectible limited edition pins for the next, 1,000 people. And what you can see is what we did is we went from just over 32% vaccination rate. Now we're up at 60% vaccination rate for employees. And they were still wearing their masks. There was no, you still had to wear a mask, because originally people were telling me, well, I still have to wear my mask. Why should I take a flu vaccine? I'm like, you're healthcare providers. You know why you have to wear them, why you have to get a flu vaccine, even if you're wearing a mask. It was a challenge. And then I said, okay, but there are still some people we need to grab. So we created the Flu Fairy. Again, we were putting the fun back in doing some of these things. We bought wings, and we sent Angie with her team of nurses, and we went to different departments. We allowed departments to sign their department up or their friends up, and the Flu Fairy with wings and a wand would go down to departments and go to them and give flu vaccines. And she'd always have little gifts, little candies or little snacks, and she would vaccinate. Sometimes they would come back and they would have vaccinated 25 people in the department. Wow. We found that, you know what, if we can't bring them to us, we're going to go to them. And that worked out really, really well. We were able to do it on different tours. We were able to make it a fun event for their department. We did it at times that were convenient for the department. They didn't have to leave the department. Someone could stay and answer the phone. We would go right to their desk, while they're on the phone, and we would be able to give them their vaccine. The same thing with the community, engaging with our community-based organizations, our houses of worship. I think we did at least 4 events at just one house of worship, and we increased by over 31% for our patients. So we're really impressed with, the rate of improvement for our community and patients, and we're still going strong. We are still offering flu vaccination. I know, we're getting very late into the season, but we did a campaign at the beginning of March, the end of February, that said, it's not too late to vaccinate. And it's just those little things that make it fun. And we had like a raffle. We said, it's not too late to vaccinate. And then we had a raffle where we gave out $25 gift cards to Target for patients. that, you know, for patients in our community, a $25 gift card to Target is very meaningful. You know, that's something that they can use for their family, for school supplies, for, you know, our Target sells everything there. So, and it's right down the street from the hospital. They're a good partner. They donate some cards for us. And then, you know, we look for ways to engage our patients, our employees, to make them good partners, to ensure that we have improved vaccination rates. So next year, I'm really setting goals higher. I want to get to like a minimum 80% for everyone. And so these are some of the things that we've done to really push forward. And I think really, you know, you don't have to invest a lot of money. Call them collectibles, limited edition, to keep your your CFO happy. Thank you.
Greetings, everyone. I am the Reverend LaShawn Nicole Slater, and I currently serve as lead pastor at Payne Chapel African Methodist Episcopal Church, located in the Magic City, Birmingham, Alabama. Yes. Clap, clap. We partnered with the Faith Health Alliance, the key word in that being faith. And so I have permission today to brag on God, all right? Because God is the reason that we have done all that we have done. And it's definitely no merit, no power, no strength of our own. At Payne Chapel, Birmingham, our mantra is we're better together. And we mean that. We worship together. We witness the word of God together. And we work the works of him who sent us while it is day, because night is sure enough coming when no man shall be able to work. And so that is why we are here today. I do have slides, and they are really for illustration purposes, because I'm a visual person. All right. And so for those who might need to make contact with a visual, I just have a few examples, a foretaste of glory of what we have been able to do over this time. So if you would please, thank you. Our work at Payne Chapel, Birmingham is hinged on community service, community education. Our goal is to bridge the continually widening gap between healthcare and those who need it. And many of us are aware that those who need it are most of the time the ones who don't get it. All right. I'm a preacher. The clicker. Oh, okay. My voice is fine. They haven't put them up yet. They don't have them? No problem. It's all good. All right. So why the church? Why the faith community? I'm glad you asked. Our faith communities, our churches, especially in predominantly Black culture, have historically been the place to get the information. They have trust, they have relationships already in play. So why not the church? What's been taking you so long to get on board with the church in the first place? All right. The relationships are in place. How does that happen? Primarily because we use the gospel as a model. Primarily because we answer folks' questions instead of just telling them what we want them to know. It makes a difference. Our agenda has to be focused and founded upon what the folks really need, and not us checking boxes for our own personal agendas. We empower folks with information so that they can make different life decisions. That's teaching them to fish instead of just giving them a fish sandwich. If folks make different life decisions, that will continue for generations upon generations and not just solve whatever is ailing them at the moment. Instead of convincing them of what we want them to do, give the folks information, all of the information, so that they can make informed decisions. So we're better together, right? Payne Chapel, Birmingham focuses on holistic ministry. That is ministry to the entire person. That's ministry that goes beyond preaching on Sunday morning. the gospel, seek and save the lost. Y'all heard about it? That was Jesus's mission. That was Jesus's purpose. Life, and life more abundantly. Not just life insurance or burial policy for when we die. Eternal life is significant. But God promised us to have a more abundant life. So how do we help people to get beyond where they are? How do we get people to grow beyond a stagnant place? We help them with their needs along the way. Jesus took the gospel to the people. You took the vaccine to the people. And even when they cannot come to you, we have to be willing to get out of our comfort zone. We have to come out of our boardrooms. We have to put on our work shoes and meet the people where they are. Take the gospel to the mean streets. Take the gospel to the hood. Take the gospel to the rural areas where the people do not have the access that we so comfortably embrace on a normal basis. How did that happen at Pine Chapel, Birmingham? I'm glad you asked. What was? Pastor at Pine Chapel, Birmingham in 2018. There was already a wellness ministry, a health ministry in place. And most of the time it was announcements on Sunday morning. Join the health ministry after church for blood pressure check. We're going to meet in the fellowship hall on Saturday morning. We got some vouchers for the food depot for our senior citizens. Don't get me wrong. It was a wonderful effort, but it had limited access. It had limited reach. And so because COVID shut us down, it forced us to take our messages to the people. It forced us to become technologically advanced and comfortable to speaking to one room. It forced us to go to them, even at 6 feet apart. We were still better together. So what did we do? We turned our wellness ministry into worshiping into wellness. And it had it still does, has a dedicated YouTube channel. What? Go ahead. You can look for it. Worshiping into wellness. That's where we do our wellness check. This week is Black maternity leave. We put all that information out there, give folks what they need. We needed a little more space, a little more time. So thank God for Shamitria Massingale, our ministry lead. She is probably observing in a virtual space on her other job. Mm-hmm. As I remind her, her volunteer role at Pine Chapel, Birmingham is still first priority. She said, okay, Pastor. We created Over the Kitchen Table. It's another segment with a dedicated YouTube page. Over the Kitchen Table pulls us together in a dedicated space that emulates our kitchen table when we have an opportunity to sit down for family dinner. Most of the time when we get all of our families together, it's some type of holiday, some type of special occasion. And when we all get together, we talk about the stuff that we don't really need to talk about. We get caught up on to-dos and life activities, but we don't talk about what happened even generations ago. How mama died in childbirth, but nobody said that she had cancer. We don't talk about the mental illness that was in our uncle. And so now our cousin is not really an anomaly anymore. Okay. So Over the Kitchen Table pulls us together and we force those conversations. Just yesterday, while I was in here, another segment dropped where we were discussing colorectal cancer. And we were able to interview my boss, our presiding elder, as he shared his personal journey. So now we have another broader reach of a group of folks who didn't even know our channel existed, and they're being educated in the process. So because of the Faith Health Alliance, we have been able to broaden that reach. What does that mean? That means we have taken our virtual stuff, our education, our resources, our encouragement, and we've been able to do pop-ups in other places. I began pastoring at Pine Chapel in 2018. However, I pastored 4 churches total, 3 of them before Pine Chapel. I started in the Black Belt. Anybody heard of the Black Belt? Yeah. The Black Belt is rural Alabama. If you look at a map, it literally makes a belt across the state because those are the poorest counties in Alabama. 3 hours from home, I would go on Sunday morning to take the gospel of Jesus Christ. And in doing so, I took with me resources that they did not have access to at home. Red dirt, don't come out your shoes. Red dirt, get in your tires. That was their reality. The roads would wash out with a heavy rain. So we went back. My grandmother said, remember from whence you have come. And so because of the Faith Health Alliance, we were able to duplicate our efforts in Birmingham, in Wilcox County, in Dallas County, in Macon County, and take those same resources to the folks who needed them, and they couldn't just go right down the street. I am grateful for the partnership. I am grateful for your support. But let me put it this way, as my soror mentioned last night. For everything that we celebrate today, we've done it on a shoestring budget. Imagine what we could do if we had some serious resources and additional funding. Truly, the work is all divine, and we give God all of the glory. But the harvest is plentiful. The laborers are few. We need you so that we can continue to work and impact those who really need it. God bless you, and thank you.
Thank you, Pastor Slater. I feel those are very appropriate words to end us off, a charge for all of us. While we're just having a couple follow-ups here, please do think of a couple questions that you have in mind. I'll just say wow to begin with. I think you all think you're the benefactors of this information, but as moderator here, I stand in awe just to hear these stories, the impacts that you made in your community, but just the passion that you have. That's what you lead with, and it makes a difference. Just a few things that really stood out in summary. We've heard about the importance and the vitality of partnerships, and that's how we increase our reach in the community. It's about reaching people where they are, not only where they are physically, but where are they in their healthcare journey? What are they ready for? The importance of healthcare provider confidence. I love your name, the joy of healthcare, and the T-shirt idea is incredible. Keith, I'm gonna get a T-shirt made up that says, I'm Keith from the 9th Ward and I love flu vaccines. I want to hear you say it. And then, of course, how to communicate and how to build trust with folks. So some very important messages that came out. I'll ask maybe just a couple questions here. Amy, maybe just starting with you. Recognizing that minority populations in general are asked less about healthcare service. Hey, you should get this or you should get that. How are we on par with those in terms of vaccines? How often are providers asking their patients or recommending to their patients about getting vaccines? And the reason why I ask that question is that, vaccines are the best deal that we have. A simple intervention that can stave off so many bad outcomes and, of course, healthcare costs. So how is the approach of asking people about their vaccine health and should they get a vaccine? How is it on par with other healthcare services?
I think it's always a challenge. I think, I agree. Vaccines are the best thing we have going. I think vaccines are a way to keep our communities healthy. I think you have to use whatever data you have. Vaccine data about what's happening in your community to educate your providers, to let them know, like right now I can tell them, 62% of our patients have that are Hispanic have been vaccinated, and that's really good, but we need more. And that we should be asking at every visit. And it's okay if patients say, not at this visit, not yet, but to continue to ask, not to ask just one time. And I think that's where we fall short. I asked them last time, they said no. But it's okay. Sometimes people need time to marinate on it. talk to them about it. Let them think about it for a little while. Give them an opportunity and ask again. And if they say no, then ask the third time. Let the nurse also ask about it. That it's not a one and done opportunity. It should be a consistent message until you have, patient feels safe and has had an opportunity to ask their question. Maybe they need to go home, especially the elderly population. I found that the elderly population will agree to nothing until they go home and they check with their son or their daughter or their friends and other family members, and then they may come back and then they'll agree to it. So give them an opportunity and the space to make an informed decision.
They're great points. I think sometimes as providers, we sort of assume like, oh, they know about the flu vaccine, or they just don't want to get it probably. That's why they're not asking about it. And that's not true. We need to bring up the conversation and make sure that we're informing and making people aware of this healthcare service. Pastor Slater, I'll try one more with you here. It's I love the Over the Kitchen Table series that's bringing health conversations to the forefront at families. I saw it firsthand. I think we saw it in one of the pictures. Walgreens had a mobile bus tour where we drove a big tour bus wrapped around with COVID vaccine information and getting people excited all down I-95, across I-4, across I-10. I mean, people were on the highway seeing this big bus that's talking about vaccines. We would drive up right into neighborhoods. I mean, right in the heart of a neighborhood, park right there and give out vaccines. We'd go and knock on a door and say, hey, would you like to get a COVID vaccine? We're right here, right across the street. And they're like, oh, yeah, let me go out and do that. And we would go see them, leave that bus and go run and go tell everybody in the community, come out and get your flu vaccine. They're right there in the bus. So can you talk of the importance of, in that over the kitchen table setup, how important it is for, people to be health ambassadors themselves? They might not be healthcare providers, right, but how to be health ambassadors and really extend the reach of information on healthcare.
Absolutely. So the Bible. Everyone who encountered Jesus did not stay the same. Many people who encountered Jesus left, ran home, and told everybody, a man and a woman. My grandmother said, experience is the best teacher. Marketing. The best marketing for no matter how large or small your company, the best marketing is word of mouth. Yes or yes? Okay, very good. When we empower people to a place of desiring instead of coercing them to do what we want them to do, they have a different story to tell. And when they do it because they want to, because they are informed, and because they feel, I have made the best decision for my life, they don't mind telling other folks about it. And when other people have experience to lean on, vicarious learning makes a difference in our lives. Some of us have to touch the stove in order to know that it's hot. But there are many of us in this room who can watch somebody else get burned and say, oh, I'm not doing that. And that's what happens when we give folk the power to make decisions for themselves. They go and tell other folk, and they bring the sheep along with them. Sheep beget sheep.
Great. Danielle and Keith, I'm going to pause for a second on a question. Please take the question from the audience. And please introduce yourself too.
Oh, hi, my name is Camille Pope. I'm with Aclinate. We actually do a lot of healthcare and community engagement work in Birmingham. So Pastor Nicole, I'm going to come chat with you after the session. But several of the panelists talked about the resources that are needed to do this type of work. And so my question is to companies like Walgreens, CVS, or even some of the pharmaceutical companies that are in the room. How are you making it easy for people to take what has been talked about here and replicate it? I mean, are there online toolkits? Because, I know from doing community engagement work that a lot of times it's on the people who are part of the community or part of the organization to kind of like figure it out. So how are you making it easy for somebody to connect with the Walgreens district manager or connect with, GSK and to get the money, the resources the staffing to be able to do flu vaccine clinics if they don't know where to start?
Great question. I'll quickly answer, and Danielle, if you want to add a couple points. But Pastor Slater brought it up, and Walgreens is very proud to be a part of the Faith Health Alliance as well, and I'm able to co-chair the Advocacy Council. One of the effort there is to have a more strategic approach to ensure that those folks that are in the community are willing and wanting to organize these events and make sure that the message and the programming still goes on. That's what's happening here. We are bringing the folks together. We're sharing ideas. We're creating connections. As an example, someone communicated to me that this is something that we want to do. Within moments, I was able to connect them with the local leadership, and they are now hitting the ground running on setting up programs. That connection is now made forever. So that's just a little taste, but I think as the Faith Health Alliance really unfolds, we're going to see more of the partnerships and strengthening relationships that you're envisioning that are going to make the difference. Danielle, please offer from your perspective.
Yeah. Yes. Similarly, with respect from our provider perspective and health systems, one of the things that we're hoping to do for AMGA and for our members is to develop partnerships with corporate funders or corporate partners, industry partners, and community-based organizations as well, to identify what are the appropriate tools and resources that we can disseminate to our members. Some of them point blank said we need digestible digital resources, things that we can use on the front lines with our communities as well. And there are also a host of resources out there already. And so really trying to figure out what are the appropriate resources? How can we compile them together and disseminate? One of the things that we pride ourselves on doing very well is convening our members together and for them learning from one another. And so as we build relationships with a lot of these organizations, we want to bring them together and convene them and connect them to our members. So not just from a national perspective, I don't want, for instance, if we were to collaborate with Walgreens, I don't want Walgreens to be a partner of the work that we're trying to do in name only, and NQMF as well. That's great that we could put it on our website, but what is more valuable to me and what's more valuable to our members and ultimately our patients that we're serving is that we provide them with the right tools and resources and connections. Simple things like how do I engage with community partners in the organizations or the faith-based communities, not feeling comfortable engaging with them. And so explaining to them and giving them tips on how to do that, those are the simple tactics that we want to be able to provide to our members and building those relationships at a national level, but then drilling it down to a local level and providing that for them as well. So I welcome the opportunity to learn more and engage with more of you in this room so that we can figure out ways to do that.
Thank you. I'm going to unfortunately cut you off. I'm sorry, but I'm going to meet you right after so I can get that question and make sure we get it answered. We have now gone over and you all know what's next, so I dare not even try that line. Please join me in thanking this wonderful panel. I'll say in closing again, it's just incredible to see this work. You all are out there doing everything you can to give patients and communities the best opportunity to achieve vaccine health. And that is what achieving equity is all about. So I think collectively, we can all work together to build upon this. Keith mentioned it. We haven't solved any problems. I believe we've made some progress. We need to build on that, learn from each other, create the programs and connections that you had just mentioned, so that we can get better on this, and that we move from the first half of this topic, which is driving vaccine equity, to the second half of this topic, where it is promoting health altogether. So thank you again for your attention.